You're live with BBC News. I'm Anna Foster here in Beirut, where we're bringing you continuing coverage from both Lebanon and from Israel on the latest escalation between the two countries, which is causing serious concern, not just here in the Middle East, but around the world as well. We'll speak to our security correspondent, Frank Gardner, very soon about whether or not these attacks by Israel deeper into Lebanon are having any impact on Hezbollah's ability to strike targets in Israel. So we'll speak to him very soon on the programme. But I just want to give you an idea of the difficulties that are being experienced by people, and particularly in hospitals here in Lebanon at the moment, which already had been struggling before this escalation began. Dr. Hassan Wazni joins us live from southern Lebanon, who works as a doctor at one of the governmental hospitals in Nabatea. Doctor, thank you so much for joining us. Just tell us, if you would, what you have been seeing and the kind of people and injuries you've been treating over the last 3 days.
Yes, thank you for asking. It's from Nabatea. It's a governmental university hospital. At Nabatea, we are the central hospital and the governmental hospital in south, especially in Nabatea. The health system now in the South Lebanon is dire, with over than hundreds and hundreds of fatalities and martyrs and injuries, and many people started Monday till now. It's just 10 minutes before you calling. It had a truck here. It's at 30 meters from the next close to the hospital, to the parking of the hospital. Many cases, at many, more than 300 injured, wounded, and more than 30 people died from them. Many cases in intensive care, still having their treatment. 6 patients and 6 injured in the burn unit. We have a burn unit here. And we transferred many of them also to other hospitals in Beirut and in, we say, in maybe safer hospital or safer areas. But now all the region, all Lebanon is not safer, as you know. The escalation is getting more and more dangerous. Now we have injured and wounded from all and martyrs all from all ages, children, women, and also young and elderly patients. The situation and the humanitarian cases are getting more critical and sensitive. And you can say a child without other family, they died on, or you can say a woman with his kid burned all over his body. Now we have many cases like this, but we can't talk everything about them because they are very sensitive. They are in very sensitive condition. We transferred many of them to
Doctor, Doctor, may I ask you? I'm sorry to interrupt, Doctor. May I ask you about because Firas Abiad, the Lebanese health minister, has talked about really the difficulties that hospitals are having being able to cope with the number of patients. For how long do you think the health system here in Lebanon can cope if these larger attacks continue?
In general, the health system in Lebanon is good, and hospitals are prepared, and they have the staff, and they have the doctors, and good doctors also, and all the equipment. But when when we are in faced a big number like this, like as it happened on Monday, 40 or 50 patients or 50 injured with martyrs on the same time. I will give you an example about our hospital. We have 20, 20 beds in the emergency room. But when they arrive more than 20, we have a problem with this. It's a the number is about we talk about the number, but now the first 2 days the patient and the wounded people was big and was incredible. Now the numbers is less than before. We can receive 5, 6, 10, maybe it's okay. But then the here is the difficulty, and here the also we should have a good connection and with other hospital in Beirut, and
Yeah,
for
of course.
transfer for
Yeah,
to do transfer the patients for
yeah.
other, and to be
And
ready
that really helps, doesn't it? And that
for
really
other.
does
Yeah.
help.
Yes.
Doctor, thank you so much for joining us. I really
Thank
appreciate
you.
your time. I know how busy you are. Thank you so
Thank
much
you.
for being with us, Dr. Hassan Wasni. I just wanted to take a moment as well to reflect on another issue which is increasingly becoming a concern for governments, is how they will actually manage to get expats out of Lebanon if this conflict continues, and particularly as we've been seeing over the last few days, if commercial airlines stop flying to the airport here. The UK and the US government have both called on their citizens to leave while there is still a limited number of flights running. Hamish de Bretton-Gordon joins us, who has been involved in this kind of evacuation before. And Hamish, we've seen Sir Keir Starmer, the Prime Minister, once again reiterate that call to leave. We know that there are British expats who are in Lebanon who are not leaving just yet. So how will they be taken out if commercial routes fail?
Well, first of all, the military staffs in the UK will have done an awful lot of planning for this, plan for non-combatant evacuation operations all the time. And when places go hot like Lebanon, those plans are dusted off. In a perfect world, and obviously this isn't a perfect world, if commercial flights aren't available, RAF transport planes that are based in Cyprus, which is only a 10 or 15-minute flight away, would be able to ferry an awful lot of people out of the commercial airport very quickly. If that is not an option, you're then looking at potentially using helicopters, big heavy lift Chinook helicopters, to lift people to Cyprus as well. And then thirdly is the opportunity to actually almost get people off the beaches into Navy ships that are in the area. It gets much more complicated if actually we have to put British troops on the ground to protect those sites that go away, to get people out. But we will be working very closely with the Americans, and I expect the European countries as well, because they'll be getting their citizens out too. I think we're very fortunate that we have Cyprus so very close, with 2 big military bases there, and no doubt with embassy staff still in Beirut being able to control these things. So it can be relatively straightforward, but if things go really badly, it can get even more difficult. So I'm sure the Prime Minister is absolutely right by encouraging people to go now, when it's more straightforward than actually having to fight your way out. But we've got a lot of experience. Remember last year, Britain managed to evacuate a lot of citizens from Sudan and Africa, and of course a couple of years ago with Afghanistan. So the only sort of saving grace at the moment is Cyprus is very close to Beirut, and we have the troops in position ready to go if required.
And Hamish, we've got about a minute or so left, and as we were touching on there, of course, the geography is part of the difficulty here. As you say, it's fortunate that Cyprus is close by, but it means that land routes, of course, to the south to Israel or to the east to Syria, they aren't an option for people to leave of their own accord. You really are talking, in terms of civilian routes, only about the airport.
Well, absolutely, you're right there. The surrounding borders are not easy at all. The terrain is very difficult. So I am sure if people want to get out, they need to listen to what the British Embassy and others are saying, get to the airport. And I'm sure that if required, the British military will be up to the task of recovering those people who want to leave even if it does get really, really dangerous, which let's hope, and we're all praying that it doesn't.
Hamish Breton-Gordon, thank you for joining us. Former soldier with the British Army, describing there as he was some of the challenges that will face expats, not just British, but from around the world.